Hello everyone, welcome to our show Thoughts on Education, an initiative by College Dunia. So today we have Dr. Sucheta Ray with us. She is the HOD of Department of Prasuti Tantra Stree Rog in Mansarovar Ayurvedic Medical College, Hospital and Research Center, Bhopal. A hearty welcome to you ma'am on behalf of College Dunia and thank you for giving your precious time to us. Shall we start the interview?
Sure, thank you.
Okay ma'am. So my first question to you is that being the HOD of this department, what are your roles and responsibilities towards the students?
Okay, hello everyone. First of all, let me introduce my department to all of you. My department basically deals with the female disorders, and it is obvious with the name, that is Prasuti Tantra, which is actually obstetrics, which deals with the pregnancy time of a female, and then the Stree Rog, which is gynecology, basically which deals with the female problems. So you see, in our society, the most unworked part is on females, and basically the females are actually the backbone of any society or country. So my department basically deals to strengthen the women, as we all know that in India, before independence and just after independence, the death due to maternity was maximum. The child death was maximum, the woman death was maximum. We have improved a lot, and I would like to tell you all that Ayurveda is working wonders in this field, because the drugs and the way of treatment we are going through is wonderful. And now let me come to the part of the students. Our work is basically to teach the students well in this part, to tell them or aware them about the gynecological disorders the female is facing, to make them free with the problems which are actually hidden in the society, in which usually the male boy or the male child doesn't want to work on. So if they are aware of the female problems, they can at least help their society, their family, their friends. So this is all our aim is towards the students. Thank you.
Right ma'am. And how do you try to bring in practical approach towards subjects and make it industry oriented?
Okay, this is a nice question. Actually, basically theoretical study is very easy, but nowadays you see in NCISM, they have given a very nice curriculum. So they are also working on the practical approach in the clinical subject. Basically my subject is clinical subject. We basically learned this subject in the final year of our syllabus, in BMS syllabus. And by that time, students are already very good in the basics or the Sanhita part of any education. When they come to us, first of all we go with the theoretical part, then we go with the training part. We first start with the dummies. Basically we have very nice dummies in our laboratories, and we give them like a false training of, we will just act like a lady is pregnant and her obstetrics or the child is obstructed. What can we do now? We make the students give them false medicines. We make the students act like they are saving a child. This is how we are giving them practical training, basically to the small kids, basically to the BMS students. This is what we are doing with the PG students. Even with the BMS students, we work on our models. They first start doing PVs in the model. They then start stitching, giving them stitching practice in the model. And then they can do the same thing in the original patients. Actually, when they go to the hospital, they are already very well versed with the training part. And even with the PGs, we are doing mock drills so that they are well versed with the emergency conditions in gynecology.
So ma'am, my next question to you is, do you have any extracurricular activities, programs to enhance the skills of the students or expose them to the real world challenges?
Yeah, sure. As I told you, NCISM and we in this college of Mansarovar, we have made a team, and for UG students we are continuously working on the basically like quiz programs. We keep quiz for the students, we keep clinical case practice for the students. That is a mock kind of thing, so that if we present them with some case, like this patient has come with this kind of case, now what is your view on this part of patient? How will you take the patient, or how will you treat the patient? In this way we are enhancing their practical activities. They are very free to express their problems, their feelings with us. They enjoy the quiz we are giving to the UG students. For PG students, as I told you, we are going with the mock drills. Basically, the typical cases we handle in obstetrics, where a patient comes with eclampsia or the shocks in pregnancy, basically, where the patients come with HIV, or how to handle a case in pregnancy with HIV, how to handle a case in pregnancy with TB, how to handle a case in pregnancy with eclampsia. So this kind of things are given to the students, and they are practically taking their hands. Will give them even the original drugs, how to break the syringe, how to act practically. Even our PGs are given with demonstration of clinical classes. They are also used with quiz practices. We are also giving them practical views on natural plant collection. Because we are a branch of Ayurveda, they go to the field, they collect the drugs which are basically useful in gynecological perspective, basically, and they come, we enjoy, we go for the field trips, we even go to the camps, and we show them the original patients and how the poor or rural India can be treated with the natural drugs, basically the home remedies. And our students are trained with the home remedies, how the poor part of India can treat themselves with the home remedies. We have taken many mock classes, mock drills, and even we have went to many villages with the students, and even it is a good outing for the students. It's a good breakup from the regular classes, and they are even learning the good things.
Right, ma'am. And how does the department or your college enhance the skills of the faculty and prepares them according to the industry standards?
See, basically, we people are given very nice trainings in between. We go and attend the CMEs. We go and attend teachers training. CCIM is actually taking continuous teacher training in different states or different parts of India. So our faculty usually goes there, take this training for 7 days, and they are upgraded with the latest modalities in Ayurveda and how to teach the students the latest modalities. Otherwise, we won't be able to do the same. So we are regularly attending the CMEs and seminars and the latest teachers training classes given by NCISM.
Okay, ma'am. And how do you see the department's greatest strengths and how it can be enhanced?
See, as I told you, my department is backbone of this country. Basically, if a woman is treated well, then the country stands well. As women, education is very important. Similarly, health of women is very important. In India, basically, women don't come up with their health problems. So, my department can actually do a very great part in this. As I told you, we go with the home remedies. We go to the rural part. We basically teach them about the homemade things, like the moringa leaves are very good in calcium sources, which are very easily available. So basically we tell the patients over there about the calcium sources they need after menopause, and they can collect those leaves and mix with their daily regular flow and make chapatis and eat them. So these are some few tips we give to them. So this is how my department is actually enhancing or strengthening India, or strengthening our country, or strengthening a part of this whole people.
Right, ma'am. And at last, what valuable advice would you like to give to the students for them to have a prosperous career ahead?
See, what I feel that my institution, or Mansarovar Ayurvedic Medical College, is a well-equipped college. As you can even see in our portal the photographs of our OT and our labor rooms and the local treatment we are giving. It is a wonderful course, students, and I would like to tell you that please select BMS, because the females are best treated with Ayurvedic drugs. And basically, one more thing, in the skill part, if I want to come, this was about the college part you should select or which you should learn. But basically what I am seeing, I am teaching since last 12 years actually, and the part I am seeing, the students are getting very weak in their responsibility part or their skill development part. So if you are coming to our college, we will give you a very hand-to-hand training and very nice training, where even patients, if are not available, we are giving you with mock things, and then we can usually go to any hospital. And in our hospital also, you can we have 160 bedded hospital, and in that gynae is having more than 30 patients every day. We are treating many complicated cases. First, after the mock treatment you are getting handed with, you can go with the original patients and you will get developed in your skill part. See, in today's life, skill development is very important. So please come to our college. It's a wonderful place. We will train you well. Thank you so much.
Okay, ma'am, and I'm sure that the thoughts you have shared on our platform will be deeply beneficial and aspiring for all the students too, ma'am. Thank you so much for giving your valuable time to us, ma'am. Thank you.
Thank you.